Hi, my name is Melissa Sugg, and I'm a student at UMO studying mental health counseling. Today, I am going to talk about the movie As Good as It Gets. This movie is like 26 years old. It came out in 1997, and I think it probably was to show awareness of OCD. While, of course, OCD has been a diagnosis for a long time, it has evolved a lot over the years in the DSM-5, with the more research and everything that's been done. So for this presentation, I used the character Melvin Udall, played by Jack Nicholson. In this movie, the character um, is an author who writes romantic fiction novels and lives in a high-rise apartment building in Manhattan. He is rude to pretty much everyone he meets. His heart does begin to soften when he has to take care of his neighbor's dog and when he learns his favorite waitress, and basically the only person who will wait on him, tells him she has a son who is sick. So we know that Melvin has obsessive compulsive disorder by the things he does. He comes in and washes his hands 5 times. Well, he comes in to his apartment after being out. He turns the doorknob, turns the lock, unlock 5 times. He does everything 5 times. He washes his hands with scalding hot water and a brand new bar of soap 5 times, 5 different bars of soap. So he does a lot of things like that, but his seems to be in fives. Um, so we learn that about all about 30% of all adults diagnosed with OCD begin to show signs of this disorder as young children. Most people receive a diagnosis by the time they turn 19, but some people may not be diagnosed until later in life, maybe after 35 years old. So we go back to Melvin and talk about, of course, we know he has OCD. So, and we're basing this on the character Melvin Udall. Obsessive compulsive disorder is a highly debilitating and disabling disorder. It's associated with a significant impairment, both of the quality of life of the affected individual and on a wider societal scale in terms of loss and productivity and functioning. So when we talk about this, we see that in this movie, we see he has to go to his favorite restaurant, well, the only restaurant he wants to eat at. He has to have a certain waitress, and he wants to sit in a certain table. All these kinds of things lead up to him having a hard time in life just in general. If he goes to the restaurant and somebody's there sitting in his seat, he causes problems. He's been kicked out of the restaurant. He only has this one waitress that'll wait on him. Nobody else wants to mess with him because he's not nice. In the beginning of the movie, his neighbor has a dog and he gets upset about things the dog does, and he takes the dog, Melvin takes the dog and puts him down the trash chute of this high-rise building, and somebody ends up finding him. Well, he ends up having to take care of this dog after his neighbor is brutally beaten. His neighbor comes up on a robbery and is brutally beaten, and he takes care of the dog and falls in love with the dog. He also falls in love with the waitress, and helps her son get the medical help he needs. He has asthma. But this character, Melvin, is even hates to hear about a sickness. So if she even talks about her son getting an ear infection or anything like that, he just winces. He doesn't want to hear anything like that. So it just all around, it is a debilitating illness. So we know this character, he's an author. He lives in a high-rise apartment building, gets upset about his neighbor's dog. He doesn't want anybody to touch him. He doesn't want anybody to come over to his building. He to knock on his door, because in the beginning, after the trash chute incident and the dog is found, they figure out that Melvin had to have put the dog there. So the neighbor and one of his friends go over and approach Melvin, which he is very, very rude to them, letting them know he doesn't want anybody to ever ring his doorbell. The friend kind of grabs Melvin up for being so mean by the shirt. Well, he freaks out about that because he doesn't want anybody to touch him. So this is where, in the beginning, when things are starting to unfold and you realize what's going on with Melvin, that he possibly has OCD. So, of course, we talked about him washing his hands, brand new bar of soap, scalding hot water. He throws the bars of soap away and the paper they were in as he washes his hands. He takes plasticware to the restaurant and, of course, insists sitting in the same place every morning and demanding the same waitress. So these are just the things he does. When we look at the DSM-5 and we talk about OCD and the criteria for this disorder, we see that it is obsessions, compulsions, or both. Obsessions are defined by reoccurrent and persistent thoughts, urges, and images that are experienced and at some time during the disturbance as intrusive and unwanted, and that in most individuals cause marked anxiety and distress. So those symptoms come along with this disorder because they don't want this. It's very intrusive in their life. So they're going to have some anxiety and possibly depression symptoms. The individual attempts to ignore or suppress such thoughts, urges, or images, or neutralize them with some other thought or action. So we do not know a lot about Melvin's background. The only thing it talks about in the movie is that when he was a child, his dad stayed in his room for 11 years. He did not leave his room. He would hit Melvin's hand with a ruler if he missed a note on the piano. So by hearing how the dad stayed in his room for 11 years without coming out leads me to believe that he may have had OCD as well, or a similar mental health disorder. But without knowing more about the dad, it would be, of course, impossible to know for sure. But that is the only background that you really get. One scene in the movie that lets you know for sure that we're talking about someone with OCD is Melvin is upset and he's sitting there playing his piano, and he's upset because he has given the dog back to the neighbor who has gotten well enough to take care of the dog. And he's upset, and his heart has really softened, and I think he realizes at that time that he really does need some help. Well, he goes down to the psychiatrist's office. Well, you learn from this scene that this is somebody he's seen before, a psychiatrist, and that he has not been there in a long time, but he goes into the psychiatrist's office and all he yells is help. Well, the psychiatrist is like, no, you got to make an appointment like everybody else. Of course, there's other people sitting around waiting. And when he's leaving, I mean, he says, you're the one that diagnosed me with obsessive compulsive disorder. Why does it surprise you that I'm in here like this? And he says, well, you have to do like everybody else does and get an appointment to see me. And um, so you know that he has been diagnosed previously. And he says the title of the movie as he's walking out to the patients. He says, what if this is as good as it gets? So he doesn't have a lot of confidence sometimes that he could ever get better. But as time goes on, he does start to get better. His heart starts to soften due to the dog, due to he falls in love with the waitress. He pays a lot of money to get her son help, which is twofold for Melvin because he wants his favorite waitress at work and she can't be at work if her son is sick. So instead of her just going to the emergency room with her son, he has hired a specialist, someone he knows through his publishing company that publishes his books. And the co-worker has a husband who is a specialist, and Melvin pays him a lot of money to help this man. So it's kind of twofold for Melvin because he wants what he wants, but in turn, this little boy does get help, and Melvin ends up falling in love with the waitress. So treatments for OCD. Okay, in the 60s and 70s, it was all talk therapy for clients with OCD. But as time has gone on, we have seen cognitive behavioral therapy be used and medications added. There's no real medication just specifically for OCD, but there's medicines that help to manage anxiety and depression, which, as I said before, go along with this because people don't want to be this way. This is something very intrusive in their life, affecting the way that they have to live, and it causes them a lot of anxiety and depression. So the combination of these things seem to work well. There is another recent treatment options, and that is called exposure and response prevention. So I can give you just a little bit of an overview of that. And that talks about it is a behavioral therapy that gradually exposes people to situations designed to provoke a person's obsession in a safe environment. So, one excerpt from this article talks about how, for example, a man who has a fear of contracting an illness from an unclean surface might hold his hands on various bathroom surfaces for a prolonged period of time, but not wash his hands afterwards. So this is the kind of thing that they're doing to help. It goes on to say, when the patient is exposed and the patient may, by practicing these habits, realize that the things they imagine or perceive happening from them not washing their hands or any other thing that may be going on, they see that this is not reality, that they did not get sick, all these things that they imagined did not happen. So and they also, counselors are asking people to try to stop these rituals while they're at home, to take time out to, if they are locking and unlocking the door, like in the case of Melvin, washing their hands 5 times, all these things, they're asking them to please be aware and to try to cut down on these rituals. And if they can try to eliminate this in their day-to-day life, it would help, and it helps to combat the stressing situations. And of course, with ERP, you can prevent relapse a lot of times because they will see for certain that this is, this is not reality, that they are getting some help. So it says, this quote from the article says, similarly, individuals with OCD experience anxiety-provoking obsessions that are triggered by various situations and subsequently perform expulsions or engage in avoidance behaviors to decrease the anxiety associated with these thoughts. So going back to that, they're just decreasing their behaviors, which will in turn decrease their anxiety and their depression towards this intrusive thing that's in their life. So over the last 2 decades, there's something come out called deep brain stimulation. And this has come out to help treat people with what they call treatment-resistant OCD. It offers an adjustable and partially reversible alternative to ablation technique with a similar reported efficacy. So this is something that's cutting edge now for people that are not responding to regular treatment and things like that. And they can do this. So it's probably, it probably would feel like a lot. It would probably feel like this is extreme, but if they're not able to get help any other way, this could be an answer for them. So in conclusion, while we understand that OCD can be a debilitating mental disorder, there is hope for anyone suffering with this issue. Therapists can use CBT or ERP combined with medications to address the anxiety and depression that accompany this disorder. While counseling may not completely eliminate all symptoms of OCD, symptoms can be significantly reduced and the quality of life enhanced. Clients will often benefit from the maintenance treatments to reduce the likelihood of relapse. So when we go back and we think about this movie and the characters and the things that happened, we understand, we get a glimpse into a day in a life of a person with OCD and how it affects and affected every aspect of his life, from eating breakfast at the same place, the hand washing rituals, the locking the door rituals, all these things that made him not only have trouble with his own self, anxiety within his own self, but he would also be very mean to other people because he was so rigid in how he wanted things that he did not want anybody to upset anything that was going on. But as time went by and the things that happened in his life and his heart softened to people, he ended up taking care of his neighbor, that he took care of his dog. When his neighbor came home, he ended up letting him stay with him. Of course, he helped the little boy of the waitress in the movie, and he fell in love with her and wanted something to do with her. So he really wanted some help so that he could do all that. So I think that he got the drive to want to get some help. So it kind of showed a really sweet ending to something that you felt like he was really kind of harsh in the beginning, but it showed after time and um his heart softening and him getting some help that he really could manage his anxiety and how he was treating others. So it was a really sweet story. Of course, it came out a long time ago. Like I said, came out in 1997. So that was 26 years ago. So some people may not have seen this movie. But it was a really good movie, and I think it brought a lot of attention to obsessive compulsive disorder, which is a lot of people have it. They may have it to some magnitude or another. I mean, not a lot, but I mean, people do have it. They may have a mild um, case of it, but still, it is treatable. And of course, with research and more research about treatments, there may end up being something that can really, really alleviate symptoms quickly and easier than they are now. But so I'm sure as it has evolved all through the years that there will be more things to come out in years to come. So anyway, I thank you for listening to me today, for learning a little bit about OCD and the character of Melvin, and how to treat OCD with some new cutting edge technology. So thank you so much for listening today.